The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
October is Breast Cancer Awareness Month. It's the second most common cancer among women, with nearly 250,000 new cases diagnosed in the U.S. each year. Here to share how early detection and improved treatments have reduced breast cancer death, we welcome from Providence Cancer Institute breast surgical oncologist Sarah Walcott-Sapp and plastic and reconstructive surgeon Allison Nauta. Good to have you both with us. Let's just start with the general information for people who don't know. So what are some of the risk factors for breast cancer, doctor?
Yeah, so we think of risk factors for breast cancer in two different categories in terms of things that patients can control and things that are a little more out of people's control.
Right.
So some of the common ones that we don't have a lot of control over are older age is a risk factor.
Right.
Just being exposed to physiologic hormones associated with menstruation, pregnancy, breastfeeding. And then women who have extremely dense breast tissue, that can be a risk factor for breast cancer, as well as women who have had biopsies that show abnormal cells in the past. And then, of course, family history of breast or ovarian cancer, and women who carry one of the known high-risk genetic mutations. And then in terms of factors that are under our control, obesity is a risk factor, cigarette smoking, alcohol use, and then highly processed foods. So.
Oh. Okay.
We definitely recommend people get exercise, avoid those bad habits and control the things they can.
What role does self-exams and also mammograms play in getting a diagnosis?
Yeah, a lot of early stage breast cancer is found on mammogram before it presents with any symptoms. Self-exams were really promoted a few decades ago, but have kind of fallen out of favor because the research never was able to show that regular monthly self-exams increased breast cancer detection rate.
Oh, interesting. Okay.
But we do recommend women just be aware of any changes in their breasts.
Right.
And of course, if they notice something that's different, bring that to their doctor's attention.
And I know there was a controversy too over the age of when to get your first mammogram. What is the latest?
Well, it depends on whose guidelines you read.
Your guidelines, I'll take.
Yeah, so according to the American Society of Breast Surgery guidelines, we recommend starting screening mammography every year at age 40. Mm-hmm. So that would be mammogram once a year for all average risk women. And then women who carry the genetic mutations or have some of the other risk factors I talked about may actually need additional screening with either ultrasound or MRI in addition to mammogram.
And Dr. Nauta, let's talk about plastic surgery. That's what you do, essentially, right?
Yes.
So how do you two work together in the operating room?
It all starts actually before we even,
work together
I meet the patient.
Okay.
Yeah, so, I'm usually aware of a patient. I will get a referral from Dr. Walcott, and we actually have a discussion and we tailor, a discussion about the patient, what the treatment plan would be. And then they come to see me, and before they even come in the room, I kind of know their particular set of circumstances. So we have a conversation. We make decisions about how we're going to move forward with breast reconstruction after their treatment for breast cancer. On the day of surgery, we both see the patient in the morning, and then we go to the operating room together. We plan the incisions out. We, make sure that we're all on the same page and work together.
What should someone look for in a surgical doctor when it comes to reconstruction?
So I would say the first thing is that you want someone who is board eligible or board certified by the American Board of Plastic Surgery. Also someone who dedicates a pretty good bulk of their practice or their time on breast reconstruction.
Okay, that makes sense.
Yeah. You want someone who really is focused on that. And that allows them to, you know, speak to and perform all the techniques for breast reconstruction. I would also say that you want someone who has a good relationship with their breast surgeon, with the surgical oncology team. That's part of what I really like about our practice, is that we're in constant communication. I'm a part of the multidisciplinary meetings that we have about treatment plans going forward. And then I would say, in addition to that, you just really want to jive with your surgeon.
Right.
You know, it's kind of unique, not unique in our field, but it is a part of plastic surgery that, you know, I think there is an increased importance of the relationship, because it is
women
long-term.
come in and they're overwhelmed. I mean, I remember back in my time, being overwhelmed with what the choices were and not feeling like understood by the surgeon. But you understand what women are going through.
Well, I think we both agree that there's a lot of information that you
it's overwhelming. Yeah.
And one of the things I like about our practice at Providence is the woman usually gets the diagnosis news from a primary care doctor, a gynecologist, someone she has a relationship with. And then we actually have a nurse navigator who calls within a few days of the diagnosis, and they'll talk through just general treatment options with patients. So it's nice because it lets women start processing things, and a lot of the time find out that, you know, maybe this isn't really going to be as bad as they thought. And so by the time they meet with me, they're a little bit calmer and more prepared to actually talk through the options and figure out what surgery they need.
We want to tell everyone, if you would like to find out more about breast cancer care, you can call Providence 844-952-1096. We'll put all the information on our website at KATU.com/Family Matters. Thank you both.
Thank you for having us.
We'll be right back with more AM Northwest, but first, let's take a